millions have used fake EU health insurance cards to scam the NHS out of millions. Britain is picking up the bill for fraudsters who have used fake health cards to gain free health care across the continent. When fake health insurance cards are used to acquire health care in Europe, EU countries are entitled to bill the NHS for this care. A shocking investigation found that the NHS has coughed up more than £1 billion over the past 10 years, but around £200 million of this is believed to be fraudulent. To see abuse of NHS funds and fraud being accepted by management was something I couldn't live with. In comparison, the nation's health service has only reclaimed £145 million in 5 years. It comes after the Sun found they could apply for fake insurance cards under the names of Prime Minister Theresa May, US President Donald Trump and EU Chief Jean-Claude Juncker using a fake national identification number. They found that the NHS has issued 57 million new EHIC cards in a decade, but 1 in 5 applications are said to be fraudulent. A source from the NHS Business Services Authority in Newcastle told The Sun he had raised the alarm but was ordered to issue more than 20 cards to the same address. He told the newspaper, "I raised these loopholes and worries many times when working for the NHS BSA. To see abuse of NHS funds and fraud being accepted by management was something I couldn't live with." Tory MP Jacob Rees-Mogg blamed EU bureaucracy. The NHS is currently facing a winter crisis, he said. When the NHS is so stretched, wasting money on bogus European health cards is a particularly egregious waste of taxpayers' money. Taxpayers' money should always be spent well. This is a potentially criminal racket, which rudimentary checks would stop. As often with an EU scheme, it leaves itself open to fraud. The British taxpayer is hopeless in getting money back from other EU countries, which is ridiculous because we have much more health tourism. We should use Brexit to make systems like this much more efficient.